I'm on week 2 of the Keto Diet and Mood Disorders course with Dr. Georgia Eid. And Dr. Georgia Eid is a psychiatrist who's in Massachusetts. And I think she's just really fabulous. She's been doing a really good job. And each week we learn a little bit more, of course. And this week I was kind of excited because when she started off talking about, psychiatry isn't the way it used to be. So now they use functional testing, and all the labs that she talked about were stuff that I already do. So that was kind of fun for me.
That's great.
Yeah, so they're taking a lot of the functional medicine, taking a more functional medicine approach, which I think is really good. And so that's good. And today, and this week's focus was on nutrition. And so that was fun. So learning all about nutrition and all the different vitamins actually that affect food, your mood. So, yeah. So my mom just got on the phone. So here we go. So we have people still coming in.
Hi.
Hi.
Had a hard time getting in.
I'm going to put you on mute though, okay?
Okay.
Okay. All right, great. Okay. Hi, Dolores. Welcome.
Thank you.
All right. So anyway, I thought we could go over some of the nutrients. And so most people are on mute. And so if you wanted to say something, I don't mind. It's just sometimes there's a little bit of background noise. So that's no problem. So just go ahead and unmute yourself if you want to say something. So no problem at all. Okay. So everyone's good. Okay. So some of the things that we talked about was, again, vitamins and nutrition. And so the first vitamin that she was mentioning was fish oil, so omega-3 fatty acids. And when I was learning about fatty acids, like your brain is about 70% fat. So all the brain neurons are surrounded by fat cells. And so it's interestingly enough, over the weekend, I was talking to this woman. She's in her 60s, and she's whole food, plant-based, vegan. And so everything I've learned on the last year or two has been like, do not go vegan. And so we had quite a discussion on her diet versus my diet, because she doesn't eat any meat. And I did bring it up in my class, because I think, what she's doing is healthy because she eats all whole foods, but and all plant-based. But some of the things that like fish oil, for example, you can't really get from a plant-based diet. And actually her diet did not use oils at all. So there's some vegan diet promoters that don't want you using any olive oil, any oil at all to help reduce the risk of heart disease. And I think it's, in my opinion, not necessary. Although for some people it might be. I know that some people have very, very high cholesterol. They call it familial hypercholesterolemia, and they have a genetic defect. And sometimes these people have super high cholesterol and maybe they don't need the fat. But other than that, I think fat is so important for the brain. She says that plant foods contain absolutely no DHA, and DHA is there's EPA and DHA for fish oil. And the DHA is super important to helping neurochemicals in the brain slide faster through the synapses, so to have speedier brain connections. So it reminded me to increase my fish oils. I didn't do fish oils for years, and that's why I like taking these classes, because I'm back on my fish oil. And so you can take your fish oil, and you can take up to 4,000 a day. In the literature, she says don't go beyond 5,000. So typically I'll tell people to take 2,000 to 4,000 milligrams a day with a combination of EPA, DHA, which is normally in regular fish oil. And so you can usually get a good quality fish oil. Some of the things that were the key nutrients that she really talked about that really can cause depression, anxiety, and things like that are zinc. So zinc was a big one. If zinc is needed for serotonin, the feel-good kind of mood hormone. And so if you don't have enough zinc, you can, that was one of the ones. And then the other one that was super important, I guess two others, iron and B12. And so iron is so important, severe cognitive impairment, and of course, development, if you don't have enough iron, especially during growth phases, like birth and puberty and, these types of things. And I've seen tremendous amounts of improvements with B12, especially in older people, because our ability to absorb B12 goes down, especially as our stomach acid goes down as we get older. And so one of my patients, her mom was in a nursing home, and she had dementia, but as soon as they started giving her B12, all of it went away, or most of it. But significant improvement in cognition and irritability and things like that. And here it says depression, psychosis, mania, dementia, personality disorders, all from deficiency in B12. So, I give B12 to a lot of people. Some of the different lab tests that you do can show, just like a basic blood count can show iron B12 deficiency. And so I end up giving out a lot of that. And B vitamins like B12, they're water soluble, so you don't have to worry about really getting too much. So, so just going back a little bit, I'm going to actually I have my notes here. I've read them, already a few times, but can't always remember everything. So iron is so important for brain function. It's required for the neurotransmitters. Iron is really not found in plant foods, so you want to get that more from the meat foods, things like that. And when it is in plant foods, it's 3 times higher to utilize. And so the heme form is so much easier. And people with celiac disease, she does a lot of celiac testing, which I don't routinely do. But I think I might try to do a little bit more testing for celiac disease, just to kind of do a baseline, because I certainly have patients that are celiac, but sometimes you don't know it. And I remember when I was a student, there was a fellow, he was in his 80s. They didn't know what was wrong with him. And he was so sick. He was in the hospital for months. I was in Arizona, and they actually flew him over to New York. And turned out his problem was celiac disease. So, can come on, I guess, at any age, or maybe he had it for a really long time and finally his body had had enough.
Mine came on probably about 5 years ago.
Yeah.
And I'm 62, so it just suddenly appeared, and wheat started really bothering me. And as soon as I took myself off of all gluten, it greatly improved.
Yeah, it makes me curious as to why, like, if you had celiac disease before, or did it just come on? You know what I mean?
Yeah, I had never had a problem in the past.
Yeah. So I think that's so interesting. And so maybe you had some kind of immune attack or something like that.
Yeah.
Yeah. So let's see here. My notes get all. So then so you want to just make sure you take a good amount of iron if you're deficient. And we always test for iron. And then there's what's called iron stores, which is ferritin. And so ferritin is another measure of your iron stores. So if your ferritin is low, that means you're also iron deficient. And of course, sometimes most people know that if you take vitamin C, it helps with the iron absorption. Magnesium, I didn't realize, I always give magnesium for muscle relaxation, help with constipation, but it's also critical for brain function. And so it says it also helps balance last week I mentioned some of the neurotransmitters, glutamate in particular, which is an excitatory neurotransmitter that gets increased with inflammation. And magnesium helps to balance that out. So it helps reduce the brain inflammation. So I thought that was good. It's helpful for anxiety, insomnia, And then again, balances out that glutamate, which I think is a big problem for me in particular. I don't know if you read the email the other day, my neighbor gave us some cookies, and I ate, of course, I ate the cookies when I got emotionally upset about something, and I ate the cookies. And then the next day I had a really bad morning, and sometimes I feel like I'm still suffering. I think it takes a bit to get out, who knows, but I get back on eating more of a keto type of diet. And I really feel it helps balance out my brain, helps me feel better emotionally. Zinc, like I mentioned before, helps with serotonin synthesis. It needs some of the B vitamins, particularly B6, to help with active, cell signaling. It also, if someone's on an antidepressant, they found that if they take zinc with the antidepressant, it actually helps improve outcomes there. And then I guess they've done studies where they've done a comparison with the antidepressant with zinc and then with zinc alone, and they found that even the zinc alone can really help with symptoms of depression. So I thought that was really interesting. And again, in regards to against veganism, it says plant foods are far lower in zinc, and it's harder to get from just plant-based diet. And if you're going to have zinc, the best form is, because there's all different types of, say, even magnesium, there's 5 different types of magnesium, and the form that I like the most is the magnesium glycinate. I think that one works pretty well. And then for zinc, she recommends zinc picolinate. So there's all different types of zinc, just like sunscreen is zinc oxide. You can swallow that one. The next vitamin that she talks about is vitamin A. And so vitamin A is in, people think of like carrots and squash, all the orange vegetables. But actually, those are not actual vitamin A, those are the retinoids. And so vitamin A itself is actually more in fatty foods. So like liver, eggs, fatty fish, things like that. And so she says even sometimes people that are not vegan can be low in vitamin A because it's not in, like if you're eating steak or the meat muscle foods all the time, it's going to be not high in vitamin A. So it really needs to come from liver and eggs and things like that. So I thought that was kind of interesting because I tend to.
I have a question.
Yeah, Michelle?
Yeah, so we cook eggs, so is the vitamin A still available in the eggs? And buying eggs like from Safeway, is there still viable vitamin A there, do you think? Or
Yeah, I think that's a great question. I think you can cook the eggs, probably, maybe gets a little bit less. I know it says here in the notes that like cooking reduces the B vitamin content. So, I mean, I don't really know if vitamin A is a fat soluble, but I would think that it's okay to cook because we don't really eat raw eggs very much. Yeah. I do definitely think that, there is a difference in quality of egg. So I always try to go for the free range, organic, grass-fed, whatever. And I think it's always funny when they say, vegetarian fed hens, because chickens really aren't vegetarian, like you don't want to give them corn, so chickens, if they're out free range, they're eating bugs, worms and bugs and things like that. They're really not vegetarian. So
that's true. I hadn't thought about that, but yeah. Mm-hmm.
Yeah, so when it says vegetarian fed, I always kind of like, I don't know about that, So
my neighbor's chicken spent the day eating bugs in my yard today.
Yeah, so that's good. So that's the quality of the yolks are really different when you get a farm fresh egg versus maybe a Safeway egg that's just run of the mill. Yeah. So
I've been buying duck eggs from a woman, and she told me that the diet that they're eating, they're finding enough food just in their yard and the water nearby. And she hardly has to feed them anything. So they're getting almost all just bugs and grass and insects right out there.
Yeah, that's pretty cool. I used to eat a lot of duck eggs a few years ago. I haven't had any in a while, but yeah, duck eggs are really nutritious. And sometimes people that are allergic to chicken eggs can have duck eggs. And then, quail eggs are also different. So sometimes egg allergy is kind of a common one. And so there's different proteins, I guess, in the eggs. So sometimes if they're allergic to one egg, they may be able to have a different one. One of the B vitamins that I thought was super interesting for me is thiamine. So thiamin's a super important B vitamin. I'm just noticing Hank's coming in. And so when I do my lab testing, I do the wellness panel, and it always comes up that people are deficient in thiamine. And I always think it's so interesting. And I know thiamine is very helpful for blood sugar regulation. It's also, I guess it says here, the brain is a high energy organ. So the brain is all electrical. So it's just working on electricity, basically, all the neurons in there. And B vitamins help, let me see here. Of course, I haven't been able to memorize all this stuff. Oh, here's. So it helps with the synthesis of acetylcholine. So acetylcholine is one of the primary energy things made from high school. You might remember acetylcholine. And it helps regulate, again, the GABA and glutamate levels, and then helps with the myelin sheath around the brain. So thiamine is real important. And then there's different types of thiamine. So thiamine is B1 vitamin. So if you're just getting a multiple vitamin, a B complex, they'll have thiamine in there. There is a specialty vitamin called benfotiamine, and so that one's like a more absorbable form of B1 that gets promoted quite a bit, especially for people with blood sugar problems. And it says sometimes if you're deficient in B1, you can have irritability, memory problems, and even numbness and tingling. So I always like giving people, especially, I always think of B vitamins for mitochondrial support, for energy. And people think, and a lot of these sports drinks and energy drinks have B vitamins in there. And so because the B vitamins help the energy formation within the cell. And so riboflavin, which is actually considered to be B2, it helps with serotonin as well. So sometimes it's hard. You don't want to take every single B vitamin separately by itself, unless you know that you have a deficiency in one. And again, the B vitamins are pretty water soluble, so they're not going to build up. With the exception of B6, you really don't want to take too much B6 because it can cause some nerve problems there. But in general, just a regular standard dose is going to give you very good support for the brain function, mood. And here again with B2 helping with serotonin. If you're deficient in it, it helps with, can affect personality, fatigue, says personality changes, and so forth. And I guess if you're going to have plant foods, almonds seem to be one of the ones that was interestingly high in some of these B vitamins, almonds and mushrooms. So, and then there's niacin. So niacin is very important for cellular energy. So niacin is part of the complex, and we've been doing more general IVs even with niacin, because it can help with addiction. It helps with alcohol recovery. It helps actually a lot with COVID recovery. So oftentimes people that have long COVID have severe energy issues. And so we found that sometimes giving niacin in the form of what's called NAD really helps with energy. So can really be helpful for also serotonin, which is important for mood. And then of course B6, and again B6 is one of those ones that you don't want to take too much of. Oftentimes people that have neurologic problems, say numbness and tingling, they might take a lot of B6. It's kind of marketed that way. You just have to be a little bit careful not to take too much, about 2 milligrams a day, but it does help with all those GABAs and serotonins, dopamine, even melatonin, which is good for sleep. So, so that was kind of interesting. One of the other ones that is super interesting for me is folic acid. So actually we want to talk about not folic acid, I don't want to say that word, but more folate, because oftentimes what they found is that you want to take the natural form of folic acid, which is folate, because they found that folic acid, which is a synthetic form, can cause cancer. And so, of course, they marketed this a lot with when you're pregnant, you want to take B12 and folic acid. And what they found, you really want to take folate. And for someone like me, folate and B12 in their natural form is called methylfolate. And methylfolate is significant for depression and anxiety and things like that. And there's a special test that you can do called MTHFR, which is called methylfolate reductase something. So it's an MTHFR test, which turns out I did the genetic test and I came up like a double positive, which is not good. And one time I was having significant depression and anxiety. This is about 7 years ago, and I went to visit my mom with my cousin. And when Stacy was there, and she was taking, I was taking a low dose, what's called methylfolate, and I was just taking maybe 1 milligram, and my cousin had a 15 milligram one. And so I said, well, give me one of those. I want to try that. And she gave it to me hesitantly because I guess she could only get so many at a time. But I took one, and the next day I woke up and I didn't have any more anxiety. So with that 15 milligram dose, so I took the 15 milligrams for quite a while, and it made a significant difference in anxiety and depression. So people, and it's even related to other neurological disorders such as Parkinson's disease, and I don't want to name off a bunch because I'm not 100% sure, but Parkinson's and anxiety and depression for sure. And so you want to take like a folate, some methylfolate. And if you're buying at the regular store, you don't want to buy just folic acid. Okay. And here it even says this folic acid should be avoided as much as possible. And things that will deplete folic acid in the body are a lot of drugs, because sometimes if people are on, well, one drug that significantly depletes this cycle is called methotrexate, which is a cancer drug. And a lot of times people will take that have severe rheumatoid arthritis or things like that. They'll put them on a drug called methotrexate, which depletes the folic acid tremendously. So they always substitute folate for them. But other drugs that will cause a folic acid deficiency is birth control pills, of course, smoking, alcohol. Another big one is diabetes medication, such as metformin, which is the most common diabetes medication, which will help reduce folate availability. And then oftentimes they need other B vitamins to work effectively. And it also says alcohol and off of these refined carbohydrates will also reduce folate availability. So that's a good folate. I love that story with the folic acid. So I continue to take folic acid on a daily basis. And then I also have my son take it because it is a genetic disorder that you can test. And so it's a one-time test. It's really not that expensive, but you can take that, and that seems to help. So B12
What
is
was that test called again?
MTHFR.
Thanks.
Mm-hmm. And in our notes here, she talks about some kind of handout that she had for MTHFR. I'm like, oh, I want that handout. I didn't see it in the notes, so I emailed this gal Susie, and I said, "Where's the MTHFR handout?" So now, and she said they took it out for whatever reason, but now they have to give it back because I asked. So So B12 is needed for your DNA. So DNA, RNA to make your red cells is also can be, if it's deficient, cause significant psychiatric problems. And it often gets low or deficient with people, especially menstruating women, also in the elderly, which, like I mentioned earlier, because you have reduced hydrochloric acid. So when I usually give B12, it's always a sublingual form, so under the tongue. I don't like people taking B12 and swallowing it because you need the stomach acid, but somehow if you just do it under the tongue, it's readily available, goes into the system. And so sometimes if people have like celiac disease or any kind of GI problem, they can become deficient in B12. And then also another big one is antacids. So oftentimes people are taking Tums or things like that because it's reducing the acid in the stomach, which is needed for B12. And B12 causes, people think of B12 for energy, but also I think of it for mood and just nerve function in general. She talks about vitamin C. I don't think vitamin C, I'm not going to overstep her, but she says it helps with brain collagen, which is vitamin C is really helpful because of it supports the vascular integrity of the arteries in the brain. And so sometimes if you're have swelling, say, like I had someone today with edema in his legs, vitamin C can be very helpful to help with vascular integrity. So also in the brain, helps keep the arteries intact, things like that. So vitamin D. So vitamin D, people think of seasonal affective disorder. So sometimes people can have very low vitamin D and they'll have depression. And giving vitamin D can definitely improve mood. And I usually like people to have a vitamin D level of about 60 to 80, and usually taking a minimum of 2,000, but I'll prefer someone to take 5,000 to even 10,000 units of vitamin D with K, because vitamin D can affect calcium absorption. And so when you take it with the K, it definitely helps keep the calcium in the right place. So Reed is joining. And then vitamin E is also a fat soluble vitamin that is an antioxidant. It helps the nervous system.
Is there a difference between vitamin D and vitamin D3?
Yeah, so you want to take the vitamin D3.
Okay.
Yeah. So most of the vitamin D that you see like at the grocery store is D3. I haven't really seen much D2 out there. There's also D2, but you want to take D3. So
Okay, thank you.
You're welcome. And then, so vitamin E is an antioxidant. Again, helps with the cell membranes. It's a fat soluble vitamin. So A, D, E, and K are all fat soluble vitamins, and the fat vitamins are really good for cell membrane. So the nerve has that myelin sheath around it, which helps the nerve signal get from point A to point B faster. And so the better your myelin sheath, the better your neuronal connections are. And so if you don't have good myelin sheath, then you get disorders such as multiple sclerosis or ALS. These are all neurodegenerative diseases that affect the myelin. All the fat soluble vitamins. And again, like I said, vitamin K she talks about is very important for the cell membranes.
You're mentioning a lot of different vitamins. Is a vitamin pill that has everything good, or do you have to take each vitamin individually?
Yeah, that's a good question too. I think it's best to you could take like a B complex. I think sometimes, if you take a multivitamin, I think that's good. It gives you the basics. Oftentimes they may not have enough of everything because it's hard to get the full amount. So usually I'll give people an extra, like say vitamin D, for example, it's always in the multiple vitamin, but it might only be 100 units versus 1,000 or 2,000. So, and I like people to take usually more up to 5,000 a day, and you won't get that in a multivitamin. So you may end up taking a few different pills, but a good multivitamin is good. And then you could take, magnesium has other benefits, like I'll give magnesium to help people sleep. So they'll take a couple magnesium capsules at night to help with sleep. And then it also helps with constipation. And now we know it helps with the brain function too. So that's good. And usually you want to take more than what's in a multiple vitamin for certain things. So any questions at all?
I want to thank you for the information, but I have to leave. So
Hey, Dolores.
I learned a lot about vitamins I didn't know. So thank you so much.
All right, Dolores, great to see you. Thank you.
Okay, bye-bye.
Dolores makes hand towels, gratitude hand towels, and she brought us some today. It's really nice. So every time you dry your hands off, you can be grateful for all the things we have in our lives. She's over 90, and she gave a talk last year at the local church on gratitude. So really nice. So I'm here to answer a question. I know it's a lot of information, and I think the point really is that there's a lot of factors, and our nutrition really plays a role in our health. What we eat, what we intake on our daily, regular basis. They talked about, the importance of fish oils, and then how you want to avoid the seed oils, like the corn oil, the soy oils, and things like that, the processed oils. Those are higher in omega-6, which is more inflammatory, versus the omega-3s are more anti-inflammatory. So that's another reason to avoid some of those processed oils. So, and I see Thomas asked if you can test the MTHFR at the office, and yes, you can. Okay. Yep. Anybody try some of the keto diet at all this week or this past week? Any dietary changes, noticing anything with reducing the carbs and helping the brain function better? I noticed that, or even Kathy, are you putting your hand up? You have to unmute. Okay.
I wanted to ask, I am trying to reduce my carbs, but I wanted to ask if proteins that are not complete proteins, like say my green smoothie has 4 milligrams of protein in it. My hemp milk that I drink has 4 milligrams of protein in it. If I can count some of those proteins, if I'm also eating a complete protein like quiche or eggs or something like that.
Yeah, you can count the protein. That's no problem. Yeah,
Okay.
definitely count the protein. I think the green smoothie is good. When the hemp, is it sugar in there? Because it's interesting. And I made another mistake the other day because I bought, a friend of mine was sick and he didn't have any protein. So I got him a protein shake, like one of those naked shakes. And turns out it had more carbs in there than protein. The advertising on there is 15 grams or 30 grams of protein. I'm like, oh yeah, that's great. I didn't even bother to read the ingredients. And then later on, I saw it was like 50 grams of carb. And I'm like, that was worse than a soda.
Yes,
So,
because you had recommended 100 milligrams of protein for me per day.
100 grams.
And so then I can figure that my hemp milk that I drink and my green smoothie and any nuts that I might eat, they all contribute protein,
Yeah,
right? Okay, great.
yes, they do. Good.
And
How,
I've heard that sometimes you don't have to eat it at the same time. You know, like I know beans have certain amino acids and corn has certain amino acids, and together they make a complete protein. But I've heard that if you have an incomplete protein at one point in your day, that it lingers in your system enough so that you can eat another protein later in the day, and it makes a complete protein eventually. Have you heard anything like that?
no, I don't, no. I don't think it works that way. I think once you eat a bean or whatever, it's, you're going to digest it, and it's not like it's hanging around waiting for the completion of its product, there is a study out there that these proteins, like say Beyond Burger, there was a study of Beyond Burger versus a regular, like a steak or, regular piece of meat. And the protein in Beyond Burger wasn't as bioavailable as the other protein, as the real protein. And so I do think that the plant proteins aren't as bioavailable, and maybe it's because they're not, complete, like you're saying. They do have protein, but they do lack. They don't have all the essential amino acids in them.
Uh-huh.
So,
Thank you.
yeah, you're welcome. Okay. We can hang on for a couple more minutes, or if no one has questions, then we can go, but I'm here to answer anything till we're done.